Before today's episode, an important message. The White House has asked Congress to rescind funding that was already approved for the Corporation for Public Broadcasting. That funding supports trusted, independent journalism like the interview you're about to hear. Without it, Idaho Matters could face serious cuts. Learn how you can help protect public media at boisestatepublicradio.org/funding. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. For 65 years, the Ada County Medical Society has been bringing doctors and medical professionals together to build a stronger community. And every year, the group honors those who have contributed significantly to the local medical community. In fact, Idaho Matters was honored to receive a Friend of Medicine award. And today, we continue our coverage of the local medical community by highlighting fellow 2025 Physicians of the Year award recipients. This year, the ACMS gave their Notable Community Impact Award to Dr. Alejandra Necochea with St. Luke's Clinic. And we're lucky enough to have Dr. Necochea joining us now to talk more. Welcome to the program.
Thank you. Thank you for inviting me.
So, Dr. Necochea, my first question is this. What made you want to practice medicine, to go into the medical field?
Wow. Well, I'm from Peru. I was born in Peru, and when I finished high school, I wanted to study economics actually, just because there was so much poverty around Peru, and I wanted to be able to do something for the community just to help people sort of improve their conditions. But then I moved to the United States, and here I kind of had a change in direction. I studied biology and then went into the health sciences in college, and I just really became interested in that. But I always wanted to be able to do more for the community, and I thought that medicine was a good way to do that. And through volunteering and other activities, I just gravitated toward that. So I came back to where I started, I think, but through a different path.
You are the current medical director for community health at St. Luke's Health System. And in that role, you've been recognized for your work with marginalized populations. Can you talk a little bit more about that? And is there maybe a specific initiative that you really are the most proud of when it comes to the work that you do?
Yeah, so there are a few different things actually, and I'm fortunate that through the work that I get to do here, I work in a lot of different areas, and some of the areas where we do our work are, for example, alleviating some of the community health needs that we see throughout our footprint, and many times those have to do with the social determinants of health that we're becoming more familiar with as impacting health. So, for example, things like housing or access to healthcare or cost of living matters. And so, for within the cost of living realm, what we're seeing in our communities is that many people just don't have enough nutritious food. And so, food insecurity is a big deal. It's a big problem for many people in our rural communities, particularly, but some of our poorer rural areas. So one of the programs that we helped that develop over the last several years is our prescription fresh fruits and vegetables program, where we help identify patients who have food insecurity, but who also have diabetes or pre-diabetes, and then we help them connect with some vouchers, some resources that they can then go and use in a local grocery store to buy fresh fruits and vegetables. And we've seen that approach has helped patients improve their diabetes a little bit, is a modest improvement in that, but also change some of the habits that they had. So they're going to the grocery store and buying things that they were not used to buying before. They're eating new things. So that can have more long-lasting effects. So we're trying to grow that program now, find more partners, because we know that there are people who have this need, and we're trying to figure out how we can get this support to more people.
Can we talk a little bit more about community health itself? I mean, sitting here and listening to you talk about things like, fruits and vegetables, getting people access to that, right? Housing. I think traditionally those things were not a part of a conversation with your doctor, right? When you go in for a medical checkup. But through the years, I think we as a society are learning more about how our health is impacted by our economics, right? By the, are we anxious? Are we stressed? How is that impacting all of our health? So I'm curious about how you view community health and why it is so necessary that this is a broader conversation that we should be having, not just, go in and see your doctor and they tell you you need to eat more fruits and vegetables.
Yes, absolutely. I mean, health happens everywhere, right? It's not like we just
Mm-hmm.
go to the doctor or the clinic and then that's where we assess and improve our health. Health is everywhere all the time. It's impacted by what happens in our homes, what happens at work, what happens when we're not in either one of those two places. It happens when we're sleeping even. And so we really need to start paying more attention to those factors, the external factors, and how those impact health. And that's interestingly the realm of public health, which is um, very good for in my opinion. I train in public health as well, and just understanding the environment and where people live and grow and develop is very important in terms of how their health unfolds. So, yeah, absolutely. When we think about all these factors, housing, access to healthcare, cost of living, transportation, food insecurity, that in many cases impacts the outcome of people's health much more than what happens in the clinic. So, for example, if somebody doesn't have stable housing, they can't afford their rent, then there's
Mm-hmm.
no way they're going to pay for those medications that we're prescribing. And they're going to defer some preventive care that could have avoided some serious condition later on. And so I think paying attention to these societal, socioeconomic factors, the things that in our environment is really important. And I think there's more awareness of that, and I hope that we can continue to work in those spaces.
How important is it to remove barriers and improve equity in medicine, in particular in a space that you work in a lot? And this is the fact that you regularly provide Spanish speaking members in our community with information on health topics, but you also advocate for Latino communities here in Idaho. So, again, what is the importance of making sure that all of our community, not just our English speaking community, has access and has equity when it comes to medical care?
Yeah, it's so strange that the word equity has become like a bad word these days. Like equity really
Right.
means equality of opportunity, right? So that whether you are a farm worker in, Jerome, or whether you are a rural grocery store employee in a rural part of Idaho, uh, or you live in a city and you just can't afford your rent, or just a regular person working wherever, we all have the same access to health, or to the resources that will allow us to have good health. So that's, in my opinion, what equity is. So when we look at that, we have to think differently about um, how we use our resources throughout our communities, throughout our society. So, for example, one example is the Spanish speaking community, Hispanic community of the southwestern part of Idaho. When COVID hit, we just didn't have enough access to healthcare. We just didn't have enough rapid outreach to certain pockets of that community, and many people didn't get vaccinated, or they didn't have the access to healthcare, and many people just died who were younger, who were not necessarily didn't have other conditions. COVID deaths became the number one cause of death among the Hispanic community in Idaho at the
Mm,
time, and you can see that with every other condition, cancer screening, diabetes care, access to prenatal care and whatnot. And so, yeah, that's one of the things that I do. Every other week, myself or one of my colleagues goes on Spanish radio, and we try to connect with other Spanish language outlets just to make sure that we can share information, access to resources, and work particularly those communities. But it's not just the Spanish speaking community, frankly. I mean, like there's refugee communities, there's
Hmm.
rural, poor Idahoans right now of all colors and religions that don't have the same access to care that maybe somebody who has a little bit more economic means and who lives in the city of Boise might have. So we have to figure out how we can get to all these pockets and support patients in the way that they need. Because you know what? At the end of the day, we're all connected, right? So like if we don't help support each other, then the resources that we have um, are not going to they're going to be spending things that we don't want to spend them in, right? So for example, if we don't help take care of people early on with a condition or to prevent the development of a condition like cancer, those patients are going to end up in the hospital. They're going to end up sicker, and it's going to be more painful for them and their families, and more expensive for the system to take care of them. And we're going to have workers who are not able to work. We're going to have family members who are not able to support their families, and that spills into the entire society. We're all impacted by this. We're all connected. So I guess those are two messages when I think about, equity. At the end of the day, we're all connected. And at the end of the day, prevention is much more fiscally responsible than just curing things once they develop.
I'm curious, what is it like serving as a liaison between politics and medicine, in particular right now?
Yeah, I actually don't go to the legislature, and that's not part of my job description. What I do is try to help advocate through other means. So, for example, with
Hmm.
physician leaders that I collaborate with in the Idaho Medical Association Public Health Committee, for example, we work on developing white papers, sorry, or briefs that then can be used to inform legislators or the community as a whole on a variety of policy topics that may come up. So that is more my role. I feel like there's an opportunity to really educate the broader community on some of these policy issues. I think, unfortunately, the legislature does not have a lot of medical knowledge right now. There aren't any physicians in the legislature right now, and
Hmm.
I have seen over the last few years that some of the laws that are passed in Idaho that impact people's health actually are discussed and debated and passed without really significant healthcare input, or even despite some of the objections of healthcare providers. We have seen unfortunate uh, consequences from those bills, and we hope that some of those decisions can be amended or changed or improved. But we shouldn't be doing this sort of like cleanup afterwards. We should have more conversations up front, and that is, I think, why having physicians, nurses, social workers just talk about what they see, what in their day-to-day work, and sharing with the community as a whole what they're seeing, what kinds of solutions we can work on together, is the way to go. One
Hmm.
example, for example, on the issue of housing, we have lots of people working on that. We have shelter people who work in shelters. We have lots of advocates, people who are providing healthcare into people who are to patients who don't have the housing stability that they need, and they're working very hard. They're experts in this. And then the legislature is like they're trying to solve a different problem. They're not trying to solve the housing issues that these advocates, these people working in this field are seeing. They're solving a completely different problem. And so there's a mismatch between what the legislature is trying to solve sometimes and what members of the society are trying to solve. So hopefully we can have more alignment between the real problems that we're seeing when it comes to people's health
Yeah.
and what the legislature is trying to solve.
So, getting back to the recognition from the ACMS this year, what was your reaction when you found out that you would be honored this year?
It was great. It was humbling. I honestly, a lot of my work is really just working with other people within
Hmm.
clinics or in nonprofit organizations out in the community who are doing all this work. So it is, I guess, a recognition of this collective work. I'm not the one who's out there helping solve these food insecurity issues or these housing issues. It's really all these other people that are doing that. I see my role as just sort of elevating some awareness in those spaces and try to connect some dots and connect people. But yeah, it was very, very nice to receive that recognition. I really appreciated that.
I have about 2 minutes left with you, and I'm curious about what's next in regards to when you look out in the community health space. What are you hoping is the next step in what you do, but in our community as a whole?
I think more of more alignment, I think, in our community and around these problems so that we can hopefully be rowing in the same direction. It almost feels sometimes like we are very divided, we're very polarized, and we're looking at some of the national political issues impacting the country as sort of the driving forces of the conversation. But when you start to look around and see who is helping who is working to solve problems, you realize that there are actually a lot of people in our communities. There's faith communities, there's nonprofit groups, there's volunteers, there's school superintendents, there's teachers, there's social workers. They are all working very hard every single day to do to do some good out there. And I think we just need to talk more about what is going on in our local communities and really support each other, participate, advocate for those people who are doing that work, and hopefully also bring our government along so they can be part of those solutions. I think there's a lot of really good work out there. We just need to get on the same page.
Well, I want to thank you so much for taking time out of your really busy schedule to chat with us. We've been speaking with Dr. Alejandro Necochea with the St. Luke's Clinic about his notable Community Impact Award from the Ada County Medical Society, as well as what he does on a daily basis. Thanks so much for joining us today.
Yeah, thank you for inviting me.
And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you were going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.